Are you tired of involuntary leakage of urine? Do you feel like you have to go all the time but can't seem to find an appropriate restroom in time? Luckily, there is an exercise that can help solve these problems. In fact, Kegel's exercises are so effective at curing urinary incontinence that they are now sometimes recommended for men as well as women who suffer from the problem. In this video, you will learn about Kegel's exercises which will help you control your bladder like never before. What is a Kegel's exercise? A Kegel is a pelvic floor muscle training and strengthens the muscles that form part of the pelvic floor. Storage and emptying of urine are the two important functions of the bladder. Although the idea of this is straightforward, the interaction between the brain, bladder, sphincters and pelvic floor muscles is quite complex. The neurological system, the bladder muscle, sphincters and pelvic floor must all work together to recognize the filling and emptying of the bladder. The muscles that support the uterus, the bladder and the large intestine can get stronger with Kegel's exercises. Both men and women who have issues with bowel control or urine leakage can benefit from it. These issues are common in elderly people, in people who are obese or overweight, in women during pregnancy or after childbirth, or after some gynec surgery, or in men after prostate surgery. Urine leakage and bowel control issues are also common in people with brain and nerve illnesses. You can perform Kegel's exercises while sitting or lying down at any moment. You can do them while you are eating, working at a desk, driving, relaxing or watching television. Should I do Kegel's exercises? Millions of people do Kegels to strengthen the pelvic floor muscles. Doing them properly can help you keep from wetting or soiling yourself when you sneeze, cough or lift something heavy. It may also relieve some of the pressure in your abdomen that causes cramps and bloating. But not everyone should do Kegels because they are not suitable for people with certain conditions like prolapsed bladder or bowel. If you have one of these conditions, talk to your doctor before doing Kegel's exercises. To get started, contract the muscles around your pelvis and hold the contraction. This will be your starting point. Squeeze your pelvic floor muscles and then slowly release the tension. Repeat these steps 8 to 10 times in a row. And this is one set. Set yourself up to do 3 sets of 8 to 10 repetitions each day with at least 4 hours between sets. If you can't hold the contraction for 10 seconds, start by contracting for 3 seconds and work your way up to 10 seconds over time. When can I expect results? The best time to perform Kegel's exercises is just before going to bed, right after you've emptied your bladder. By repeating these exercises 3 times a day, 5 times a week, you should see results in 2 weeks and continue seeing the benefits of these exercises as long as you continue to perform them. Performing these exercises in between menstrual cycles will also help improve any pre-existing urinary incontinence issues. Be mindful of not over-squeezing during these exercises, as this could lead to excessive stress on the pelvic floor muscles. The pelvic floor muscle group controls a urinary and fecal continence and some sexual functions including erection control in man, sphincter functions and intestinal control. Tips for doing proper Kegels. First is, tighten your pelvic floor muscles as if you are trying to stop the flow of urine. Second is, hold this contraction for 3 seconds and then relax. You should feel the muscles between your legs tighten and release with each contraction. Third is, do this at least 10 times in a row, 3 times a day to tone these muscles and increase bladder control in both men and women. Pregnancy and childbirth and strength training. To ensure proper pelvic floor function, it is important to exercise both the pelvic floor muscles as well as the abdominal muscles. One exercise that may help strengthen both sets of muscles is called Kegel's workout. Women can practice Kegels by stopping and starting their urine stream when they are in the bathroom or by tightening their pelvic floor muscles and holding them for 10 seconds at a time, then releasing the contraction. When exercising your Kegels, be sure not to overdo it. You want to slowly build up your strength and endurance over time. People with low back problems or prostate problems should avoid doing this exercise before consulting the doctor. There is an alternative exercise to Kegels which is called Clamshell exercise. The link is in the description below.